there. Welcome back. Let's take one cleansing breath before we begin. Thank you so much for joining me in that. I'm so grateful to you. So let's again talk some more about ketamine. I am a therapist that has special training in ketamine assisted psychotherapy. And today we're going to talk about who should even think about taking ketamine. And I know a lot of you have seen these ads on Instagram, TikTok, and other social media platforms, and you're kind of wondering, is this right for me? Is this something I should consider? Is this something I should do? Well, let's talk about it, okay? Ketamine is a really effective medication in working with depression. It has been approved for the use in depression for a special type. That's a nasal spray, along with an SSRI. And it has been approved to treat both depression and a more severe form of depression, major depression. So that is what it's been approved for. Right now, there's over 140 studies being done on ketamine for other conditions. Now, most of those studies, about 70 or so percent, are specifically on different conditions. It is being used off label for other things. I've been using it in my practice for anxiety. I'm not a doctor. I do not prescribe medicine. I have my clients go on these online platforms, find themselves ketamine that works for them, find a company that aligns with who they are. I use Better You. It is my preferred provider. I find that they are very in tune with the psychedelic work. Most of them pretend like the psychedelic experience doesn't exist, or they have a very conservative approach to the use of ketamine. I am not of that vein of thought. I have been working with the medicine now for over 2 years with clients, and I've taken it myself, and I have found that more frequent experiences have longer lasting results, and that is currently what the studies are showing. So I'm not understanding this conservative approach that several of the companies are taking, but I am more along the lines of embracing the psychedelic part of it. Okay, so what kind of things have I been treating with it? Anxiety. I have to say, anxiety is probably the number one thing I treat in my practice with ketamine. People come to me either through one of the portals that I have created because they know that I do this kind of work, and they come to me for integration. Integration is the process that we do after we've had the ketamine experience. I also work with them very, very diligently with set and setting. Set and setting are everything. I know some of you have had psychedelic experiences in perhaps a music festival or in some other party format, and it wasn't a very good experience, and you think that that's what this is. This is not that. We are creating a sacred space for this medicine to do its work. This is not something that we're trying to trip out of our minds. This is an experience where we're looking for clues into the subconscious mind, where we are trying to integrate our trauma and pain into our current life and embracing that, looking the trauma straight in the face and going, hey, you're not that scary after all. That's what ketamine helps us do. Ketamine works wonderful in my practice, at least, and anecdotally across the studies for anxiety. It also works very well with depression, and that has been clinically proven. But we also have been seeing it being very useful for people with PTSD. It is a disembodied experience, so a lot of people are afraid that the disassociation associated with the psychedelic experience is similar to the trauma of disassociation. This is not the same thing, and I can tell you that the trauma is presented to you in a very gentle way. When I saw my trauma in my experiences, it was more like, hey, do you remember this happened? And I went, yeah, it did. Yeah, I was 12. Yeah. And I could let it go. I was 12. It's over. There's no tiger around the corner. Those bad people aren't there anymore. And that is what ketamine gave me. That insight. The insight to be in this moment and to know I don't have to react to old pain. That is what ketamine does. It releases some of your ego so that you can be more of a viewer of your life rather than being very involved in every little conversation, every little talk. Every time you get involved with some toxic relationship, whether it be with your family, friends, work, you can now just say, this isn't really aligning with who I am. I don't think I want to involve myself in this. I think this is a good place to put in a boundary. It gives us that. It gives us that kind of insight. That has been my experience not only with myself, but also in my practice. So do we really need to label these things? Do we need to label them? Anxiety, depression, PTSD, do we really need to label them, or do we just need to treat our conditions so that way we can live the fulfilled life we've been looking for? I don't think we're all just diagnoses running around. I'm this, I'm that. It doesn't really matter. We have to treat these conditions. And ketamine might just help you get to that next level. Might help you see yourself from far away so that way you can give yourself an analyzed approach of who you are. If you enjoy doing your own work, if you have read a buku of self-help books, ketamine might be for you. Now, if you're a kind of person that needs a psychiatrist appointment and thinks if you don't have this medicine or that medicine, you're off your meds and you don't know how you're going to cope, this might not be for you. This is for someone who really wants to do the work, make the understanding, make the connections, and let them go. This medicine helps you let it go. Now, wouldn't that be lovely? So anyway, those are the kinds of conditions that most people who are working with ketamine are treating right now. Now, there are some conditions that are very challenging to treat, and psychedelic work might not be for you. Now, I'm not a doctor. I don't do the prescribing. I let these companies, Better You or whoever you're using, I let them make the choice as to whether or not you are able to take the medicine. But I can tell you most of them just are concerned about your blood pressure and your pre-existing conditions. There are some conditions that you should probably not even try ketamine. If you've had psychosis or you're actively in a manic state, ketamine probably isn't right for you. But if you're stable in those things, maybe it might be worth a try. But you have to make the choices that are right for you. Talk to your therapist, talk to your psychiatrist, and definitely talk to the professionals who prescribe this medicine. They know what conditions it works with best. So anyway, that is my talk for today. It felt so intense, and I don't want it to feel like that, because really this medicine can really bring us to the next level. It can take you where you've been wanting to be. I am so grateful for having found it, not just for my own heart, but for all of my clients who've been struggling for so many years to finally find the clarity they've been looking for. I want to thank you again for coming and for bringing in both your heart and your head. And I want us to stay intentional here. And please, if you can, like and subscribe. My entire goal is to heal communities, and I can't do that without you. So please spread the word. And if you have these at home kits, please write something down here in the comments so that way I can take a look and see if, where everybody's at. I'm hoping that we'll continue to grow the channel and build a community of people who heal at home. And I want to be your partner in that effort. So, anyway, thanks again, and I will see you next time.